welcome to the final part of this exercise for low back pain little series of videos. And what we are talking about now is the final principle of how to overcome, reduce, or reduce the risk of injury of our lower back. Now, as you can see, we've got a little graphic here of a skeleton. Now, don't worry too much about the positions that it's in, or the views that you've got, be it the front, the side, and the back. All I've used this for is to help you guys understand the way the body wants to work. So what we've got here is, obviously you can see down at the bottom here, I'm just putting my circle around it, this is the ankle joint. Then we've got the hip joint, and then we've got the shoulder joint here. Oh, and you could also say the thoracic part of the spine here, which is this middle bit that runs basically the length of the ribs. Now, all of these areas of the body want to be mobile. Our body is built to move, essentially. Hence why we've got a mobile joint here, a mobile joint here, a mobile joint here, a mobile joint here. Now, there are more, but those are the ones that we're going to focus on. Now, one of the causes of, or one of the influencing factors of low back pain is stiffness or tightness or tension in these mobile joints. So you may have tightness in these mobile joints. That can be contributing and putting extra pressure on your lower back. So the final principle of how to overcome, reduce, or just decrease the risk of low back injury is to make these joints mobile. So try using stretches and different exercise movements to mobilize these joints and increase the range of movement at those joints. Because when we do that, we can start to take away some of the stiffness of, i.e. around the hips, which can then ease the pressure on the lower back, and then therefore ease the pressure or ease the incidences of pain coming out of the lower back. Now, what we have to understand is just making them mobile isn't the whole story. If you have, let's say, scar tissue on the muscles or on the ligaments and the tendons of the lower back, then obviously that scar tissue is going to have to be sort of worked out of the muscle. If you've got, for instance, disc herniations, again, the disc herniation has to be resolved first. But what that can do is that can start to immobilize the joints and therefore increase the pressure. So once we understand where our low back pain is being caused, we can then start to help remove it by bringing extra mobility to the ankles, the hips, the thoracic spine, the shoulders, so on and so forth. Okay, so thanks for watching these few videos. I hope it's been helpful. Hope you're able to go away and start applying some of the principles that I've talked about. So many thanks for listening, and I will speak to you in another set of videos. Help you guys understand the way the body